The budget reflected that. It reflected that by prioritising bulk billing, by prioritising strengthening Medicare, prioritising the skills crisis that we inherited, but also prioritising fixing budget repair as a direct result of the decisions that we made to find $40 billion of savings over our two budgets, to return to the bottom line 87% of the revenue improvements, upgrades to the budget bottom line. We inherited almost $1 trillion of debt as a direct result of our turnaround, going from a forecast just a year ago under Scott Morrison and Josh Frydenberg of $78 billion deficit for this year. That's been turned around to a forecast $4.2 billion surplus. That is the biggest fiscal turnaround that we've seen. And today's backing up of the increased investment in primary health care we were able to achieve whilst achieving that fiscal turnaround. That's why it was a responsible budget, beginning fiscal repair, but also one that delivers what was needed for Australia at this time.
Why do you think that it's only 20%? Clearly that shows that there's going to be a lot more people that need convincing.
Well, we'll be out there talking about the difference that this budget makes to them. The people that we've spoken to this morning here, where it will make a difference. The fact that bulk billing will continue to be provided in this quite extraordinary medical centre here is a direct result of our policy. Had Labor not been elected, we would have seen a further undermining of Medicare, a further undermining of bulk billing. We know that for a long period of time, one of the great divides in Australian politics was John Howard promising to get rid of Medicare, and since then they decided that the Australian people had such support for Medicare they couldn't promise that. So instead we've seen it undermined over the previous decade. What we've been doing is repairing it, and that is a centrepiece of our budget, along with our other measures. Our measures for skills and training here in South Australia, the 4,000 additional STEM places that we'll need for the submarine project that will occur in Mark Butler's electorate there at Osborne. That will make an enormous difference as well. That number of jobs in construction, and then ongoing up to 5,500 jobs building submarines here in Adelaide. But what we need to do is to make sure we have the skilled workforce to do that. So that was another major priority in our budget of last week.
Another challenge for South Australian health is attracting young doctors to become GPs themselves. How does it change in Medicare?
Yeah. Well, one of the things that the Royal Australian College have said very clearly in their announcement of support for our initiatives in the budget last Tuesday night, and I'll ask Mark to supplement this, is they welcomed it because it was showing, as well as making a difference, it was showing GPs that they're valued. There has been an issue with increasing numbers of medical graduates as a proportion going into specialisations rather than GPs. And that in part, I have no doubt, is because of the ongoing failure to support our primary health system as the centre of our healthcare system. We can't have our primary healthcare system continue to be in decline because of the pressure that places on our public hospital system. It is so important as a way forward.